Thank you very much, Greg, and thank you all for joining us today. So last night, the Alaska State Virology Laboratory confirmed that a middle-aged woman from Fairbanks was identified as being infected with the H1N1 swine flu. This is the first case of H1N1 swine flu that's been identified in Alaska so far, and the patient's onset date was approximately 2 weeks ago. The patient had no history of travel outside of the Fairbanks area prior to onset of illness, and the patient had no known contact with a person diagnosed with H1N1 swine flu. 3 other household family members are currently well, and state and federal health officials are trying to identify other contacts who have influenza-like illness in the Fairbanks area who might be infected with this novel H1N1 swine flu. The patient is currently on vacation and out of the country, but we were able to contact her today, and she says she's feeling well and has fully recovered. So in order to protect the patient's privacy, no additional personal health or identifying information will be released on this patient at this time. So what are the implications of this for Alaskans? Well, this virus is known to be contagious, and it's highly likely that it's circulating in Fairbanks and possibly elsewhere in Alaska currently. It's spread mainly from person to person through coughing, sneezing, also through touching an object that may have been contaminated by a sick person, and then touching your eyes or mucous membranes. The signs and symptoms are the same as seasonal influenza, including fever, cough, sore throat, runny nose, body aches, headache, chills, and fatigue. The severity of this strain of influenza appears to be quite similar to seasonal influenza, and people who are at increased risk for seasonal influenza, for severe illness from seasonal influenza, include people who are older than 65, children younger than 5 years of age, pregnant women, and people with chronic medical conditions. Now, at this time, there are few cases and no deaths reported in people older than 64 years, and this is unusual when compared with seasonal influenza. People are thought to be contagious for about 1 day prior to their onset of illness, and then up to about 7 days after onset of illness. So what can Alaskans do to protect themselves against this novel strain of influenza, and also to protect others? The first thing is, if you are ill, please cover your nose and mouth with tissue when you cough or sneeze, and throw the tissue in the trash after you use it. It's important to wash your hands often with soap and water, especially after you cough or sneeze, and alcohol-based hand cleaners are also effective. Avoid touching your eyes, nose, or mouth. Germs can spread this way. Try to avoid close contact with sick people. And again, if you are sick, it's important to stay home for 7 days after your symptoms begin, or until you have been symptom-free for approximately 24 hours, whichever is longer. This is to keep from infecting others and spreading the virus further. So I think at this point, we'll go ahead and open the floor to questions.
Okay. Which country was she on vacation in?
She is currently in the Caribbean, getting a tan.
How was she diagnosed with it? How did we figure out she has this? And did she get on a plane at some point after that? Was she still contagious, or do we know that?
Right, so at this point, we know that the patient's onset was somewhere around 2 weeks ago. This is complicated by the fact that she has allergies, and she also had what appears to be perhaps a sinusitis. So it's a little bit difficult at this point for us to determine exactly when her symptom onset was. We're thinking, based on the information we have so far, that it was about 2 weeks ago, perhaps a little longer than 2 weeks ago. She traveled out of Alaska approximately 1 week ago. So if you do the math, she's right at the cusp of that 7-day period after which she would no longer be infectious. So we are currently working with CDC to try and determine how to follow up on that.
So what was the timeline on that? Like, she became ill 2 weeks ago, and when did you guys take the test? And then why the lag time between whenever the test was taken and last night is when you figured it out?
Right. So the patient was seen by a healthcare provider on the 21st, so long after her symptoms started. And at that time, she was presumptively diagnosed with a respiratory infection that seemed consistent with a cold. However, she did have a fever, so the healthcare provider went ahead and obtained a rapid influenza test, which you can actually do in the office. And that rapid influenza test was negative. And this is not surprising. We've actually seen nationally that the rapid influenza test is not very sensitive in some locations. Some states have reported very low sensitivity, on the order of about 60%, is about as low as I've seen for the rapid test. So anyway, this rapid test was negative, but the physician felt that since the patient, or the provider felt that since the patient had a fever, he would go ahead and obtain a culture as well. And so he swabbed the patient and sent that swab to the state virology lab in Fairbanks. And that specimen was tested yesterday, and we got a call yesterday evening from Terry Schmidt at the state virology lab to confirm that the patient was positive with this novel strain. I don't know, Terry, if you have anything you'd like to add to that?
Yeah, just actually the testing began on Tuesday. It's a multi-step process, and so we just finished up the testing late yesterday as a confirmation of the novel H1N1 influenza.
Any other questions?
Yeah. What about people in Fairbanks right now? What are health officials doing there differently now that there is a case?
Right, so public health nursing staff have been notified, local EMS staff have been notified, as have infection control staff in the hospital. So those notification messages have gone out. Epidemiologists from the state health department are trying to do a disease investigation, trying to determine whether or not close contacts of the patient have come down with an illness, and if so, then we'll go ahead and see if it's warranted to go ahead and do further testing on those patients.
How confident were you H1N1 would arrive in Alaska before this case?
Well, I think we all knew that it was coming. It was just a matter of when. So fortunately, we were not, well, fortunately or unfortunately, we were not the last state in the U.S. I think West Virginia is still the only state that has not notified CDC that they have a confirmed case. We just were notified yesterday that Wyoming, the state epidemiologist in Wyoming, notified CDC that they have a couple of cases there. So, yep, so we're the second to the last state. So we knew it was coming. At least we were quite confident that it would be coming. We just didn't know when.
And do you expect more?
I think it's highly likely that we'll see more cases, yes.
How unusual is it for the first case to not be somebody who had traveled outside of the state?
Well, interestingly, you know, initially when the epidemic started, the biggest concern was travel to Mexico. And the latest data that I've seen from CDC is that only about 14% of patients who have been diagnosed as of last week sometime had a travel history to Mexico. And right now, the United States is in the lead in terms of the number of cases that we're seeing nationally, followed by Mexico. It's a little unusual. I guess I would have been less surprised had the patient had a travel history outside of Alaska. But the fact that this is our tourist season now, we've got a lot of people coming into Alaska, and Fairbanks is a destination for folks, and so it doesn't surprise me that much that the patient did not have a travel history or a history of known contact to an H1N1 case. Any other questions? Yes.
So, you know, I know some cities down south have some jobs such that if you've gone to Mexico, do not come to work in 10 days or so. Do you have any businesses like that in Alaska who had the same? Well,
our current recommendation is still consistent with CDC's recommendation, and that is if you do come down with influenza, our recommendation is to stay out of work, stay home for 7 days or at least 24 hours after your symptoms have resolved.